No matter how hard we try, we all get hit with the unexpected at one point or another. It could be an illness or a sudden death in the family, and we can't always prepare, which is why today we want to work on healthy ways to cope when something happens. And so with us right now is Dr. Jenna Mendelson from Cone Health. She's a licensed clinical psychologist at LeBauer Behavioral Medicine. So we're going to talk about ways how to prepare ourselves and our kids and some kind of coping strategies and things of that nature. So really, families and people, they prepare for certain things. What should we be preparing ourselves and our children mentally for, handling events ahead of time?
So we do know a bit about the kinds of factors that promote healing and resilience after unexpected tragic events. Among them are strong ties. A strong sense of community can really promote healing and resilience. Also, having advanced preparation, and that can include having counseling source resources readily available in the event of a tragedy, having a plan to follow up following a traumatic event, and creating a plan for in the moment response that is practiced in advance.
That is practiced in advance, which is kind of hard to do when you're thinking to yourself, you have to prepare for you don't know what, but we're going to kind of unpack that as we go along. So let's first tackle this. The conversations that we should have as a family on a regular basis to help prepare for the what ifs.
hmm I think it's such a fine line because we want to use language that is going to be developmentally appropriate for our kids, where we're telling them what they need to know in language that they can understand without giving them details that might be unnecessarily scary. So that's going to vary from family to family, but thinking about what that would look like for your children and your family, and having a routine for practicing these kinds of things. So, for example, if you're preparing for what you would do at home in the event of a tornado, you might introduce what a tornado is broadly, talk about, okay, when do we know how to enact our plan? Where do we go when this happens? And then actually act out the plan. It can be helpful to make this part of a routine so that kids can kind of get used to this is just what we do, this is no big deal, and also so that in the moment of a scary event where they might be in a fight or flight response, they can easily just go straight into the plan without having to think about it too much.
Maybe like where you all meet afterwards or something of that nature, so that is a constant for them.
Exactly, yes.
Okay, so unfortunately, we're all going to be faced with some kind of tragic or sudden event at some point in time. It could be a storm, it could be the death of a family member, it could be a sickness. What advice do we have for coping with it in that moment?
So, first and foremost, accessing your social network, the people you have in your life that can support you, your community. Asking for help, accepting help when it's offered can be a really important coping strategy. Some degree of return to structure and routine can be helpful in just regaining a sense of normalcy, but it's a balance because following a traumatic or really upsetting event, you are also going to be coping with a lot more emotionally. I tend to think about it like doing all your day-to-day routine with a 100-pound backpack on. Like you can do it, but it's going to be hard. And just managing your expectations of yourself as you try to return to your routine, it can be helpful to incorporate activities proactively that calm your nervous system, and ideally, even having some of those activities as part of your routine before something upsetting happens. That can be like yoga, breathing exercises, grounding exercises, and that's the kind of thing a therapist can help you find the activities that are going to be the best for you.
Mhm.
And I always recommend try to refrain from making a major life-changing decision in the 6 months after a really traumatic event.
Yeah, because so many things are coming at you at one time that what you are thinking is going to be the right choice may not be the right choice because things are still in flux. All right, so what about parents and caregivers? What advice do you have for them to help with that?
Yeah. Well, first having, again, some social support, some people that you can talk to without having to edit yourself too much and just kind of let it out, so that you're able to maintain those boundaries with your kids and not expose them unnecessarily to details that they might not be able to cope with. This is where professional help can really come in, especially if you don't have those people in your life that you feel like you can speak to in an unedited way. That being said, it's okay for kids to see parents upset. What can be scary is when kids can sense that the people around them aren't feeling right or are having big emotions and having no idea why. So you want to have some language that you can use to explain to them what's going on and to reassure them that you're still their strong parent who's going to take care of them. You're just feeling sad right now. And in
Hmm.
doing so, you can even model for them that it's not weak to have emotions. You can be a very strong person and have all kinds of challenging emotions, which will help them in managing their own emotions down the line.
Yeah, the whole "it's okay to not be okay" thing.
Exactly.
All right, we're
Exactly.
going to talk about what happens if someone doesn't want to talk about something and something awful has happened and they just don't want to talk about it. What do we do with that? We're going to talk about that when we come back from this break. We're back with Dr. Jenna Mendelsohn. She's talking about coping with the unexpected. All right, so what happens if you know someone should be talking about it, but they're just not talking about it?
That's a tricky situation because, of course, trying to force somebody to open up is unlikely to be very effective. If that somebody is your child or just a friend in your life, letting them know that you're there for them and they can talk to you about anything, reminding them of that, and then also creating opportunities to talk. So if the person is your child, being around them, having things that you do together where you're not talking too much. And if they choose that moment to open up, you're there for them. If that person is just not going to open up to you, making sure that they have people in their life that they can open up to. So if that's your child, encouraging them to open up to their friends, or if there are other adult relatives that they can talk to, or a therapist, that can be a way to help them feel that the opportunity is there if and when they're ready for it.
All right, well, let's talk about some unhealthy patterns because that's something that's very common. Sometimes people fall into unhealthy patterns dealing with difficult times. What are some of those and what should we be aware of?
So, some pretty clearly unhealthy coping strategies can include substance abuse of really any kind or risky behavior. Sometimes people will resort to doing really risky things that kind of generate a really intense alternate emotional response and takes them out of whatever it is that they are trying not to feel or overwhelmed by. Some less obvious unhealthy coping strategies can really be a normally healthy coping strategy if it's your only one. So, distraction can be a wonderful coping tool if done in moderation. But when it gets to the point that now all you're doing is binge watching TV and you're finding it difficult to go about your day to day tasks, it's become an unhealthy coping strategy. So, I typically recommend proactively seeking out a variety of coping strategies so that you have healthy coping strategies and so that you can vary how you cope with stressful situations.
Not just one way, but vary it. Okay. Now, in the days and weeks that follow, coping can still be difficult. Going back to a normal routine can be, kind of challenging. So, how long should someone wait before saying, I might need to talk with somebody?
Don't wait. If you've been through something really traumatic, there is no harm in going to see a therapist. There's absolutely no need to wait. In fact, you may be able to help yourself more proactively so that you don't get to the point of a crisis by seeking out help sooner rather than later. That being said, some red flags that you may really need to go speak to somebody would be if you're really having a hard time doing things that used to be easy for you, if you're resorting to some really unhealthy coping, like you find yourself drinking a lot or using drugs, it's time to get some help. If you are having symptoms of an acute stress response, which can include a feeling of hypervigilance, like you're always waiting for the next terrible thing to happen, panic attacks, nightmares, tearfulness, irritability. Those can all be symptoms of acute stress disorder, which can eventually turn into post-traumatic stress disorder. And that's a sign that you should probably speak to somebody and get some professional help.
So, are the signs different in kids and adults that may indicate that they may need help to get through this life event?
Yeah, so kids experience all the same emotions that adults do, but they don't often or they don't always have the words that adults have for describing their emotional experiences. So children are often more likely to express their emotions somatically in terms of physical symptoms, like saying that they have a headache or they have a tummy ache, and sometimes they just kind of have them. Sometimes it seems like the symptoms start when they have to do something that might remind them of the traumatic event that happened. Sometimes too, kids will act out behaviorally when they are having a difficult emotional experience. So that can be a previously pretty easygoing child suddenly becoming aggressive or even bullying towards other kids, being really irritable, having angry outbursts, or having, tearful outbursts where they just seem really fearful and sad a lot of the time. That can be a sign that your child is coping with a difficult emotion.
Okay, and so there's only about 30 seconds left. Are there any different adult ones that we should know before we go?
I think adults experience all the same feelings, but just maybe have a little bit more insight that what they are experiencing is an emotion. That being
Hmm.
said, sometimes adults could be having a very challenging emotional experience and not have the words for it either.
Yeah, sometimes it is that way. There are no words for certain things when you just get to that point. We thank you for
Absolutely.
giving us your insight, and we want to make sure that you have the resources that you need. Maybe you do need to talk with someone, or a loved one does. We want to put this all on our website for you so it's easy to find. Look at for WFNYnews2.com.